Hello guys, yesterday I got a WhatsApp message. One of the students was asking, ma'am, you trained for OPRA exam preparation. So do you have AI-based mock tests for OPRA exam preparation? I told her, if you want AI-based mock tests for OPRA preparation, why do you want me to train you? Just take a ChatGPT subscription and type in metformin MCQs, and you'll have hundreds of MCQs generated on metformin, just simple medication, and then you prepare from it. Why do you need me to train you for it? So here in this video, I would like to explain you about the RASCH methodology for OPRA exam preparation. Let me clarify, RASCH methodology is nothing new. It has been there for every exam, which is a licensing exam for healthcare practitioners worldwide. Like many Western countries have already adapted this method, and it has been in Australian pharmacy practice, like testing exams for ages. If you take Australian intern pharmacist written exam, it's based on RASCH methodology. There is no secured score for you to pass the exam, but they test you for your current knowledge and practice-based awareness. And after all, you're a healthcare professional. Are you able to practice as per the standards here? That is what is being tested. They don't calculate your percentage or how many questions you attempt rightly or wrongly, but they will see how you perform in the exam overall, and will you be able to fit in the system here. And we at Elite Expertise have trained like more than 60 intern pharmacists. I think 60 is so less. It's more than that. I think approximately 70, I would say, to clear their licensure, Australian intern pharmacist written and oral exam in their very first attempt. And Australian written exam, intern written exam, is a RASCH methodology. So what is a RASCH methodology? It tests your knowledge, your skills to practice as a healthcare professional. It doesn't have a secured, like a particular like score system that this much marks you score and you fail or you pass the exam, but it depends on your overall performance. And point number 3 is, you won't have any discrimination against the other candidate. Every candidate is treated equally and fairly in testing methodology, and they get equal set of questions with good, equal set of hardness and a mixture of easy questions, and they will see your overall performance. So the performance is all about you. And who can help you clear this exam based on RASCH methodology? Someone who can teach you clinical aspects of daily practice in pharmacy. And that is as simple as it. And fortunately, I would say at Elite Expertise, we still have human brains. The teachers here, me and Sir Arif, we use our human brains to teach our students. We are not relying on any AI tools to teach you. And the only tools which we rely on are Australian Medication Handbook, therapeutic guidelines, renal drug databases, and we use up-to-date guidelines as well. That's the American practice guidelines to teach you. So basically, we strictly follow the knowledge impartation to help you clear the exam. After all, you will deal with patients, not with machines or robots, to think about artificial intelligence-based practice. So this is not encouraged. And one more thing, Australian Pharmacy Council in their YouTube channel have clearly mentioned that their test is based on human intelligence. It's not AI driven or something like that. And people sitting in Australian Pharmacy Council are brilliant pharmacists. They set questions based on human knowledge and understanding of healthcare practice, because you would be put in a situation where you have to deal with patients, and then you type in paracetamol in ChatGPT, and then you say, okay, this is a dose of paracetamol. Are you a healthcare practitioner or someone who's like guiding the patients? Okay, so there's no AI tools which we recommend at Elite Expertise strongly. No Googling, no ChatGPT for OPRA exam preparation. Only strictly follow the clinical therapeutic guidelines of Australian pharmacy practice. And for more information, always refer to Australian Pharmacy Council website, their YouTube channel, and you find all the genuine information. Okay, my question to you is, what is triple whammy effect? Comment in the comment section below without referring to ChatGPT, please. See you.